Ooh, this one I really, really love, you guys. One of the things that I really um, love doing is teaching people how to become consumers of therapy, because I think we have this misnomer in our society, or this misconception that therapeutic clients don't really have to do anything, that they go in, the therapist works some magic, and then they feel better. And I mentioned that a bit, I think. Um, well, that's really not the case. And that sets everybody up for disappointment and, quite frankly, failure. Because if you think you don't have to do anything, why would you? Right? So, one of the questions that I received was, how do I voice my intentions for what I want to get out of therapy? I love this question so much, and the answer is really twofold. The first of which is, if you have a good therapist, the therapist should be asking you. I believe that question should be asked in the very first session, because otherwise, why are you there? You guys both need to get on the same page about the job that you're hiring the therapist to do. And if it's not asked in the first question, if there's a lot of intake, there's a lot of history taking, that can sometimes happen, but it needs to be asked within the first 3 sessions for sure, so that you guys can get a treatment plan going. You need to know why you're there so that you can measure your success. So in 6 months, you aren't coming into your therapist going, gosh, I like you. I'm okay coming, but really, what have we done and how's my life different? I don't really know. So you need that common language to be able to measure your goals, measure your progress. So if your therapist doesn't ask that question, either on the intake form or you guys don't specifically talk about it, even if it's on the intake form, you should be talking about it. In that first session, or up to 3 sessions is probably pushing it, but it's okay if it's 3 sessions in. Then you can totally voice those things as a client. In fact, I would highly encourage you to. So thinking about, what is it that I want to get from therapy? Do I want to go somewhere and just have a confidential place to vent? If that's the case, that's fine. You may consider a group or a friend to do those things with, rather than paying a therapist to vent to, if you're not working on specific goals. However, if you and your therapist both agree that that's what you're doing there and that's fine with both of you and that works for you, excellent. If you want something out of therapy, like, I want to be happier, say that to your therapist, so your therapist can go through setting goals with you, can say, okay, what does be happier mean? Because my be happier will look very different from your be happier. My be happier might just mean I want to wear cushioned socks. What are those? Slippers? And eat popcorn and watch a movie every night. And your be happier might mean I want to make $250,000. I want to get married. And right now I'm not even with anybody. So do you see how the different measurements really do make a difference? You want to get really specific about those goals. A good therapist will be able to walk you through setting up those goals in a way that you guys can measure it together. So even if you don't come in saying, I know specific goals and how long it's going to take me to get there, etc., that's okay. You don't really need to know that yet as a client, especially if this is the first time you're going to therapy. But certainly you do want to come into therapy with an idea of what you want, and say to the therapist, hey, this is why I'm in therapy. I want to be happier. They'll be able to ask you questions. You guys will be able to get on the same page. And from thence, a wonderful and hopefully productive conversation about what your intentions are in therapy will happen. If you have a question for me, or if you have a question for me that was answered, but there's still a little bit more you need to know, Email me at recapearl@gmail.com. It's REACAPEARL@gmail.com, or visit me on my website at recapearl.com. I hope to hear more from you soon.